Hello and welcome. Thank you for joining us today. I'm Alysson Satterlund, Vice Chancellor for Student Affairs, and I will be your moderator for this town hall. Today, we have a group of panelists to provide some updates on events and operations during the COVID-19 pandemic at UC San Diego as part of our Return to Learn strategy. And we're here today to answer your questions, some of which were submitted during registration. You can also feel free to use the Q&A window to submit additional questions for our panelists. Due to our time limitation today, we will not be able to get to all of your questions, but we will log the questions as they come in and post the answers on the Return to Learn website. I'd also like to remind you that this webinar has live closed captioning available in two ways. First, you can click on the closed caption button at the bottom of the screen and select Show Subtitles, or you can also click on the link that is pasted into the chat. Today's agenda will include what's new with campus events, enterprise events and production management, and this a strategic project that we've been working on for some time, Regents Policy 5402 and wage parity, of course, a COVID-19 pandemic update, current event guidelines, meetings versus events, food and beverages, vaccination and testing for events, the activities and events intake form, and future guidance. And now I'd like to introduce our host of today's town hall, Vice Chancellor for Resource Management and Planning, Gary Matthews, for some welcome remarks.
Thank you, Alysson. Good afternoon, everybody. It is wonderful to see so many people. It's close to 200 of you on the call, and I'm very grateful for each of you for all that you've done over the last many months to get us to where we are today. Your support, dedication, and embrace of the public health guidelines have made a major difference. It's also very exciting today to be talking about events. Think about the lockdown that we've gone through, and now we're at a point we can honestly talk about how to get together and commune and have events together. All great stuff. For those of you that are vaccinated, I thank you personally. I was able to get my booster shot the other day, and I was a little sore for a couple of days, but at the same time, I think it's clear that vaccination is an important step. So for those of you that have gotten vaccinated, I thank you. For those few of you that have not, there's still time to do so, and there are other options should you decide not to that will be discussed very shortly within today's presentation. I also want to take the opportunity to really thank the great panelists that we have today. They have been working throughout the pandemic. Many of us, I mean, it's interesting to me to hear, oh, we're returning to campus. Many have never left the campus, and several, if not all of the panelists have been here throughout trying to ensure your safety and most importantly, the safe operation and safe return of the thousands of students that are now here. So today's meeting is an exceptional step forward. I am happy to be your host today, to be part of this great organization, and I'm proud to be a Triton. We've got a lot of information for you that I think is extremely important, and I won't belabor it anymore. I'll turn it back to Alysson, and thank you all for all that you do to keep us safe and focused. Thank you.
That was beautifully said, Gary. Thank you so much. Now I'd like to introduce our first presenters, Executive Director of Special Events and Protocol, Jill Townsend, and Executive Director of University Centers, Sharon Von Bruggen. They will be giving an update on ESR, Enterprise Events and Production Management.
Thank you, VC Satterlund. Hi, everyone. My name is Jill Townsend, and I'm excited to talk to you about the Enterprise Events and Production Management Program, affectionately known as EEPM. It's part of the Enterprise Systems Renewal Project. And what is it exactly? It's going to be a system or a system of systems to support event planning and production at UC San Diego on an enterprise or campus-wide level. What does that mean? It means that all events that are going to be planned on the main campus, including SIO, will use this new system. That includes student organizations, venue managers, departments, units, divisions. So we're very excited about this strategic project that VC Satterlund mentioned. Next slide. The goals and benefits of this, simply stated, are to improve management, compliance, health and safety, analysis, and user experience for all events on campus. It's a pretty big undertaking, and our goal really is to help to simplify the process to host an event on campus. The plan is to reduce the number of tools needed to schedule an event, to comply with campus policies and protocols like the major event protocol and alcohol permits and the like, streamline finding a venue to hold your event, make that a little easier to do, improve event communications and calendaring so that folks can find all the wonderful events that do happen on campus, improve event initiation workflows and supporting technology, right? So it starts with an idea and then it comes to an event. We want to be able to make it easier to get from that the conception of the event to the actual event taking place. And to include event-related data analytics and metrics to help the campus keep track of what's happening in terms of events on a day-to-day basis and on a year-over-year basis as well. And last but not least, to support safe reopening during these COVID times and to make sure that we're doing all that we can to keep our campus community safe and secure. Next slide. Why? Why is this important? A couple of years ago, there was a strategic program and management of shared public spaces committee that got together and did some work and identified that there was a lack of synergy in events on campus, identified that there's more than 20,000 events on campus annually, which is a huge number. Part of the problem, though, is folks don't know where to find the information. So it's difficult for audiences to find what's interesting to them. And it's difficult for campus to know what's going on at the same time. There's a lot of different event planning tools and calendaring options and scheduling applications. Again, that just increases the burden on those that are trying to plan and market these events and on those who wish to find these great things to do. And accessibility of resources varies. So it's sometimes if you know, you know. And we want to make sure that everyone can have equal access to finding rooms and equipment and being included in campus marketing activities. We want to support, as I mentioned, the health and safety of our campus community through having clear clear awareness around what events are happening and when they're occurring and who they're bringing to campus or to that particular area at the time. And finally, increase awareness around available events and programs. Campus is not socially dead. The campus is a destination, and we want to make sure that we ensure that folks can easily find that and engage with us. I'm going to go ahead and turn it over to my colleague, Sharon, to take it from here.
Thank you. So now that Jill's told you a little bit about the project, I want to share with you a bit about the work that we've been doing and where we're headed. So over the course of several months, we met with many subject matter experts on campus who do event planning to really understand the event initiation process. What does it take to start planning an event on campus? This was really important for the next steps that you'll hear to develop an events and activities intake form. Right now, during this process with COVID adjustments to our events, we also met with the EOC and with the university-wide events task force to determine what those adjustments were and how to adjust the intake form to accommodate during this time. So we have stood up an events and activities intake form. Many of you are perhaps using it already, and we will talk about it a little bit more later on in this session. But our next steps in the project are really to look at event planning and the rest of those steps, all those things that Jill just talked about. We're meeting with our subject matter experts to really map out and understand all the different tools and processes that are being used, everything that's needed to comply with campus policies, whether that be the MEP, the major events protocol, completion of an alcohol form or others. How do you go about scheduling an event? How do you find the right venue for your event? And is that easy and simple to do? We really want to improve the event initiation flow and process for planning events, both virtual and in person. And again, providing leadership with the metrics and analytics for the events that are happening on campus. So we're mapping out that process with our subject matter experts. Hopefully some of you are on this session today, but if not, we know we'll be seeing you soon. Next slide. And if you have any questions about this project, or if you just want more information, I encourage you to visit the ESR webpage or the Campus Events and Activities portal, which is available on Blink. You can also email the team at esr-events@ucsd.edu. Thank you.
Thank you so much, Jill and Sharon, for your leadership on this important endeavor, and of course for the overview today. We'll now hear about Regents Policy 5402 and wage parity from our colleague Otis Crockett, Senior Operations Manager of Labor Relations.
Thank you for that introduction. My name is Otis Crockett. I'm the Operations Manager for Labor Relations here at UC San Diego, and I'm going to talk with you today about Regents Policy 5402, the policy generally prohibiting contracting for covered services. It's also referred to as AFSCME Article 5 sometimes. There are four main things I want to go over with you today. I only have about 5 minutes, so I can't go through everything in the policy, but I think these four areas will help you as you're thinking about your events. Next slide, please. The first area I want to talk about is a little of the history of this policy. So in 2017, the University of California was negotiating a contract with the labor union that represents our service employees. And our service employees are custodians, food service workers, building maintenance workers, and our security guards. As part of those negotiations, the union wanted the university to agree to never contract out under any circumstances the work that is done by those particular employees. The university did not agree to that. As a result, the union used their influence with the state legislature to get the university to compromise on this particular point. Regents Policy 5402 is the compromise that the university came up with. The important point I think you should all understand is the regents are fully aware that this policy could increase costs and may limit your operational choices when you're putting on events. However, for the reasons I talked about before, this was a compromise that the regents thought was in the best interest of the university. Next slide, please. So what is this policy that we're talking about? Well, at the very base root, the policy generally prohibits contracting out of covered services, and I'll define that in the next slide. It generally prohibits contracting out for covered services and functions that can be performed by university staff. So if it's something that can be done by a university employee, the policy generally prohibits us from using an outside contractor to do that work. However, contracting out is allowed under exigent and limited circumstances when a contract is a solution of last resort. And it's very important to understand that point because the policy is construed and to be read very, very narrowly on the issue of an exception to policy. Next slide, please. So I talked about covered services. And so the definition of a covered service is simply one of the services that our employees who are janitorial, who are custodial, who are transportation and parking, who are food service, who are security services. Covered services are those services that those employees provide. So What that means is generally, if you have an event that will require custodial work to clean up, parking or valet service, security for the event, full service catering for the event. The reality is that this policy may apply to you, and it likely does apply to you. There are so many nuances to this policy. I can't go into detail for each one, but rest assured that if you have any of those services needed or used as part of your event, this policy likely applies to you. Next slide, please. However, just as I talked about, there are limited exceptions to the policy. And there are about 6 different exceptions. 5 of those exceptions really do not apply in the events context, so I'm not going to go through those. But there is one exception that may apply depending upon what's going on with your event. So when the university does not have employees capable of providing the required service at our location, we may be able to use an exception to the policy and use an outside contractor. The best example of this I can think of is if you have an event that requires 200 or 300 security guards. Well, we don't have that here at UC San Diego. So that might be an exception to the policy that allows us to go to an outside contractor. But relevant to the events, I think it's very important that all of you should know that an increased cost because facilities management or housing, dining, and hospitality is charging you more, that is not a qualifying exception to policy. The fact that you don't like housing and dining catering service, unfortunately, that is not an exception that will qualify under the policy. The policy is read very narrowly, and again, it's only when those services cannot be provided. Next slide, please. This is another important point that everyone should understand. Even if we're able to have an exception to the policy requires the outside contractor to pay what is called wage and benefit parity to their employees. And for the lowest paid employee here at UC San Diego, a food service worker, the wage and benefit parity rate is about $27 an hour, meaning that the contractor either has to pay $27 an hour to their employees, assuming no benefits, or a combination of wage and benefits that equal $27 an hour. As you can imagine, that will significantly increase the cost to you and your events. But as I said before, the regents were aware that this policy would increase costs, but they implemented it anyway because it was the best compromise for the university. Next slide. So this is a big policy, and you may be thinking, well, how do I deal with this? The great news for all of you is that you don't have to navigate this alone. Procurement and labor relations have been tasked with administering this policy and helping all of you be able to navigate all of the nuances of the policy. I will say this policy is a hot button issue with the regents and with the union that represents the employees. They are looking and checking every week to see that we're in compliance. So if you haven't talked with us in labor relations before, I ask you that before you schedule your event, contact us at labor relations at ucsd.edu, and we'll walk you through the policy and make sure that you are in compliance. And with that, I'll turn it back over to Vice Chancellor Satterlund.
Thank you so much, Otis. And now we'll hear from Dr. Chip Schooley, Professor of Medicine, to give us an update on the state of the COVID-19 pandemic.
Part of the challenge for all of us over the course of the last year has been not just looking at where we are now, but trying to project where we're going to be, because our challenge is always to try to plan for the future with what we are living with today. And this epidemic has been one that has kept us on a roller coaster. As you can see here, we're now on our fourth peak of cases on the way down, which is good in the US. Next slide. After about 700,000 deaths. You can see in California in particular, we didn't get to quite as high a peak relative to our population as many other states did. A lot of this was reserved to states that had large numbers of people in the population who had not yet been vaccinated. California is one of the more vaccinated states in the country, and we didn't have as big a surge as some of the other states did. Next slide. We're seeing as well, as school started, we saw a surge in cases, and most of them were from the Southeast, where there was interference with masking in schools by a number of the politicians. But you can see that as masking in some of those areas came into compliance with court cases that allowed school boards to impose masking, the number of cases in children has also declined steadily for the last 5 weeks in a row. So in general, our epidemic nationwide is moving in the right direction. Next slide. Now, when you look at the county epidemiology, you can see that the number of cases has been declining steadily in San Diego. We're down to a range of 300 to 350 cases a day. And the number of hospitalizations in the county has also decreased steadily. You can also see that when you look at who's in the hospital on the lower right panel, that while we have, this is UC San Diego Health as of yesterday, you can see we had 40 people in the hospital, and of these 40, 34 of them were people who were not vaccinated. Only 6 were vaccinated. But if you looked into the ICU, 11 of the 12, that should be 11 and 1, 11 of the 12 were unvaccinated. So we're seeing that most of the seriously ill people in this county continue to be non-vaccinated people, and the ones who are ending up in the ICU and on respirators are almost exclusively non-vaccinated. Next slide. On campus, things are relatively quiet among the employees, which is terrific. You can see on the lower right panel, we're having 0 to 3 cases a day among our employees. Virtually all of them are breakthrough cases, which are generally mildly symptomatic. And by that, I mean, people feel like they've got the flu or feel kind of tired, may have a sore throat, and often mistake it for an upper respiratory infection for a day or two. And one of the points I want to make today is if you feel something like that, you should get tested for COVID these days, because that's what it most likely is. We don't have a lot of influenza floating around. You can see our student body is having in the light in the left lower panel that cases both on campus and off. Most of them are off-campus cases, and we've had very little evidence of spread around the campus otherwise. Next slide. To get an idea about where vaccination stands, you can see that our students are between 90 and 95% vaccinated. Our campus employees are about 90% vaccinated. We're still doing some reconciling of the numbers. Dr. Socia will speak to this in a few minutes. Over in the health science side, because the mandate for health workers is earlier, we think that at least 95% of our health science employees are vaccinated in the county. We're getting close to 90% as well, which is very good news, because this will dampen some of the direction things are going if we get another variant in the future. San Diego should be reasonably well protected. And I don't think we're going to have the kinds of surges and waves we've had in the future that we've had in the past with this vaccination rate, although we will continue to have cases among the unvaccinated. Next slide. In terms of vaccines, this is kind of a timeline that shows you that 2 weeks ago, the CDC and FDA authorized boosting for people over the age of 65 and those who are at risk for being in contact with people who are at risk. And by that, I mean healthcare workers and teachers of people K through 12 who are either being in contact with vulnerable populations, patients, or people who can't be vaccinated, children. Looking to the future, next slide. Right there, you can see that there is an FDA advisory committee hearing that's going to be held in about 10 days. At that advisory committee hearing, they're going to discuss the application from Pfizer for vaccinations for children 5 to 11, booster shots for Moderna vaccinees, and booster shots for Johnson & Johnson. We anticipate, I think, that all 3 will move forward positively, and we'll be in a situation in which we'll have those populations will have access to vaccines by the end of October. It's a little bit less clear when the Moderna vaccine for children 12 to 18 and for the Pfizer vaccine 2 to 5 will be coming along, I think, sometime by the end of the year. So we should be in a situation where most children are vaccinatable by the beginning of 2022. And last slide. I just want to end with one slide about a study that was reported last week. This is a study with a drug, molnupiravir. And the reason this is important is this is the first oral drug that one can take after symptoms begin that has an impact on the epidemic. This was the study that was on the virus. This was a study done with 750 people, randomized half to receive this oral drug and half placebo and next. What you can see is that the number of people who ended up sick enough to be in the hospital was halved in those who got the active drug. What I'm not showing you here is that of the 8 deaths in the study, every one of them was in the group who did not get the drug. So this is one more safety valve that will let us continue to increase our safe operations as we move forward. Let me turn this back to Dr. Satterlund, and thanks very much for your attendance.
Thank you so much, Chip. Now we'll hear from our campus health and safety expert, Dr. Angela Sosha, who will focus on some of the important health and safety guidelines. Angela serves as our interim executive director of student health and well-being and the beloved chair of the vaccine mandate work group.
Thanks, Allyson. And Chip, I think you did a great job really sharing how dynamic this has been. And what we've done over time is always adjust our campus policies with a mind to keeping everybody as safe as we possibly could, keeping operations going. And so you'll see that there are some updates, and I just remind everybody kind of where we are for this fall. So we continue to require indoor masking. I know that was a little odd in the summertime, but it was prudent, and we saw Delta was starting to come, and I think it has served us extremely well. That indoor masking and having everybody masked does a lot to prevent transmission, and the science behind that is pretty clear. So when you're in an indoor space, regardless of your vaccination status, please don't take off your mask unless you happen to be in your own office alone and it is an enclosed office. This is not true, though, if you've been exposed to the virus, and we're going to talk a little bit about some updates on exposure. There's a good there because vaccination has really changed a lot for us, but not everything. So keep in mind, indoor spaces, mask on unless you are alone in your personal office and you have not been exposed. No eating or drinking there. And I know that's a little tough, but it does really help to keep that mask on continuously. Outdoors, you are not required to mask, with the exception if you've been exposed, and we'll be talking about exposure. But for most folks, even if you haven't been vaccinated, you can not be masked. But we would encourage you, if you're in a crowded situation, put a mask on. There's no downside to masking. So if you are in an outdoor crowded situation, regardless of your vaccination status, please mask. For our students living on campus, we had a great movement of the undergraduates. Over 10 days, all 12,000 students moved in. We picked up 13 individuals who were carrying virus, which was a very low rate of positivity, much less than we expected, and we were able to isolate them very quickly. The students are now masking in their residential units with the exception of their bedroom and their shower. We call this phase 1. With time and things looking good, and they are looking very good, we will move to phase 2, and they'll be able to take the masks off within their units, which is kind of like how we live in our households. Next slide. For testing, we're a little different here if you're vaccinated or not vaccinated. And remember, we are under the mandate now that you need to be vaccinated or you need an approved exemption. I know many employees may be in that transition period while their exemptions are being reviewed. So while you're in this period, unless you are fully vaccinated, you follow the requirements of the unvaccinated community. So for the vaccinated community, which means 2 weeks after you've completed this series of the vaccine that you're taking, remember that our Pfizer Moderna are 2-dose series and our J&J is a 1-dose. 2 weeks later, you're considered fully vaccinated. Although boosters will come into play for the mandate, we are not requiring a booster right now. So if you've been fully vaccinated and you have new symptoms, please test. Don't come to work with symptoms, get a test. You shouldn't come to work until you're better, because you may have you may not have COVID, but you could have the flu or a common cold or some other infectious thing going on. So stay home until you're better. If there is a wastewater signal in a building that you live in or work in, please test. If you've been exposed to the virus and public health has notified you, you need to test upon notification in day 5. The unvaccinated community needs to follow all of the above, as well as surveillance testing. Surveillance testing means you get tested regardless of symptoms, where we want to check you regularly, and that is twice a week for the fall quarter. And that should be no less than 3 days apart or no more than 5 days apart. So the unvaccinated community, or partially vaccinated because you haven't hit that 2-week mark post your final dose, you need to test twice a week. It's very important. Next slide. Let me go back one quickly, to mention that the students are, for the first 4 weeks of fall quarter, we're recommending that the vaccinated students test every week, and employees are encouraged to do this. So we're just doing this for 4 weeks so we have a real good feel of how things are going the early part of fall quarter. Next slide. I want to take advantage of the vending machines. The vending machines are accessible to employees as well as students. If you are an employee, though, you need to have your first test with the Price Center or one of the health system drive-ups. Once you've had that first test, you can use the vending machines. You need your campus ID to access a kit. You swipe, that'll release a kit. You then, you may see $1 on, that comes off immediately, so there is no cost to you. The kit will be released. It will have all the instructions, including a swab and a testing vial. It's very important, though, that to identify the sample to you, and that is done with the UCSD app. You must have the UCSD app on your phone to use the vending machines. You open up the app, you capture the barcode on the vial. That's how we know it is your sample. Make sure that you can see it clearly when it's captured. As long as that's been done, we know that that test is yours. After you swab your nose, you put the tip that you swabbed into the vial media, screw on the top, and you drop it into the testing bin right next door. There's one bin for the actual vial and one bin for the clamshell that you get your kit in, because we can recycle those. If you don't see a result within 24 hours, it could be that there was a failure to capture the barcode or something else has gone on. In the abundance of caution, retest immediately if you don't have your results back in your My Chart or My Student Chart within 24 hours. We have 20 locations of these vending machines. They work great. That's the way most of the testing is actually occurring on campus. If you don't have a phone that can capture the barcode, you can go to the Price Center and the staff will help you with testing there. So you do have on-campus testing if you'd prefer support and can't use the vending machines. Next slide. So update on the new exposure quarantine guidelines. And this is important. And they're different if you are vaccinated versus unvaccinated. If you're an unvaccinated individual, you need to remain off campus. Residential students are moved to quarantine housing, isolation housing. You need to test upon notification and on day 5 post-exposure. This is extremely important. Delta moves quickly, and most people who will convert and develop an infection will be picked up by day 5. You have a period of 7 days in which you need to monitor symptoms. Please do the daily screener. If you're an unvaccinated employee, you actually cannot return to work until 10 days after the exposure. That is a Cal OSHA requirement. So the unvaccinated community still cannot be on campus if they've been exposed, and they can't work until 10 days out, and they need a negative test on day 5, no symptoms, then you can return back to normal. The vaccinated have a very different situation, and this is really a big change from the past. If you've been vaccinated, you may be on campus as long as you're not having symptoms. You do need to mask not only indoors, but also outdoors. So the entire time you're on campus, except when you're eating, and please eat alone. Our students who will been exposed in this setting will move to special housing, but they can still come to class. So the vaccinated community can come to class. They can also work. It is important, though, that you do the day 5 test. And if you don't, and you don't develop symptoms. If you develop symptoms, it's a different issue. If your test converts, it's a different issue. Next slide. And the last thing I want to let you know is we have a preview of an update we're making to our daily screener. We're going to take advantage of the daily screening, which looks at symptoms and exposure. We're also going to take advantage of your vaccination information, which you shared because of the mandate, and your testing pattern if you're unvaccinated, and that you're doing the correct testing if you're doing the twice a week unvaccinated surveillance testing. We're going to put all of that together into basically 3 thumbs. A green thumb, you're allowed to campus, all of this is good. A red thumb, you're not allowed on campus. It could be because you haven't complied with testing. It could be new symptoms. It could be an exposure to an unvaccinated individual. It could be a variety of reasons. It will be a very simple, you really can't be on campus participating in events. A yellow thumb, you can be on campus, but you need to be masking even in the outdoors, and you need to eat alone. Generally, a yellow thumb will be a vaccinated individual who has an exposure but has no symptoms, and they can continue to participate with the additional masking and eating restrictions. So those are some of the nice updates for this fall, and I'll be answering questions in the chat and later on. Thank you, Alysson. Returning it back.
Thank you so much, Angela. Now we'll turn this over to, once again, our executive directors, Jill Townsend and Sharon Van Bruggen, to speak more about events on campus.
Thank you, Vice Chancellor Satterlund, and thank you, Dr. Schooley and Dr. Sosha, for providing us the context for our current event planning guidelines. I think a good place for us to start as we move forward in this conversation is with the event definition, which is available on the Return to Learn website. An event means any planned gathering at a UC San Diego location, including but not limited to celebrations, dances, lectures, forums, performances, social gatherings, concerts, speaker presentations, conferences, or athletic contests and tournaments where 25 or more people are in attendance or are expected to be in attendance. An event does not include an academic class or seminar, department meetings, laboratory meetings, or other routine business meetings. And for those, you'll want to get your guidance from the campus safety page. And I think the slides have already been shared, so you should be able to find that link there. So now Jill and I would like to walk you through event-specific guidelines. Next slide.
First up, we're looking at indoor meeting guidelines. While this is an event presentation, I think there's a lot of confusion between meetings and events. So hopefully we're going to try to clarify a little bit of that for you here. You have the event definition that Sharon just gave. So if it's not an event, but people are gathering, it's a meeting. Here are the rules for that. Indoor meetings, again, definition, academic classes, seminars, department meetings, laboratory meetings, etc. Every attendee must be masked, as Dr. Sosha shared. No attendees required to provide proof of vaccination status for those. No food or drink is to be consumed at an indoor meeting. This is an important piece. This is something that can turn an indoor meeting into an event. So be judicious. No food or drink at meetings. If you have a desire or need to serve food or drinks, then you're going to follow the event protocols. Participants and attendees can include all manner of folks. Students are there. Students can attend a meeting. For students who want to house their own meetings, if you're a student organization, please work with CSI or your college organization advisor when considering how to host a meeting. And then finally, organizers should provide a remote meeting option in case folks are unable to make it in person. Next slide.
Okay, for off-campus events, many of you have asked us about guidelines for events that you're holding off-campus. For those events, you must follow the California Department of Public Health guidelines. Remember that indoor settings are especially high risk for transmission, And a key method to reduce that transmission, both indoors and outdoors, is to verify attendees are fully vaccinated or have recently tested negative for COVID-19. And don't forget that masking provides additional protection. Next slide.
Okay. On-campus event, current guidelines. So outdoor events are presently allowed, but they should be constructed carefully to avoid large crowds and to minimize density at the events. Consider requiring face coverings or masks. It's not presently required, though it may be for events that exceed 1,000 attendees. Food and beverages are permitted at events outside. Self-serve buffets are not permitted, but box snacks and plated meals and individual beverages are allowed when there's ample space for folks to distance. Next slide. Non-essential indoor events are not permitted up until October 31st, and we're going to cover what happens next a little bit later. If you have a need to have an essential event, it will need to be by Vice Chancellor exception. You'll use the events and activities intake form, which we'll show you in just a moment. That was part of that EEPM process that we spoke about earlier, is this activities and intake form. So we'll talk about how that works. You would submit your request there for an exception, and it would need to receive Vice Chancellor approval to move forward. Indoor events that can be held virtually should be done online. All visitors and guests must provide proof of vaccination or have had a recent negative COVID-19 test within the last 48 hours. And we'll talk more about how to do this in a moment. And finally, face coverings must be worn for indoor events if permitted by exception, and are strongly encouraged for outdoor events as well. Next slide.
Okay, so for those vaccination and testing requirements, for safer events, please follow these guidelines at your events. For students, staff, and faculty, you're going to want to check an ID and their symptom checker with that green or yellow thumb for admittance to the event that Angela just talked about. If they have a yellow thumb, they will be allowed to attend the event, but they must mask even if outdoors. In the future, this symptom checker will have a vaccine, is expected to have a vaccine policy compliance note as well. For your non-affiliate event guests, you're going to want to check an ID, and also for proof of vaccination or proof of a negative result, full vaccination, or proof of a negative result of a COVID test within the last 48 hours. Now, remember that full vaccination is 14 days past the second shot of Pfizer or Moderna, or 14 days past the single shot of Johnson & Johnson. And for acceptable proofs of vaccination, you'll look at the California Digital Vaccine Record or their vaccination card, either a photo or their card itself. And for acceptable forms of the test result, if they're doing the test result, that can be paper, digital, like the MyChart, or email. And just remember, if they don't have the proof, if they're not fully vaccinated, if it's inconclusive or positive on their test results, the visitor or guest, the attendee, may not attend the event. Next slide. Now, it is the host group's responsibility to check the symptom screeners, the vaccination cards, or test results. So we did want to offer you a couple of best practices for doing this. One is this is a visual check. You do not need, nor should you, store or record the symptom screener, the vaccination cards, or test results. Just do a visual check. If you're in a large open space, you might consider utilizing wristbands for screened individuals so that you know they've already been screened. And we strongly encourage you to assign additional staff to your check-in process, because this does add time to that process. And have an escalation idea, an escalation process in mind. Identify someone on your team who will be responsible for managing any of the challenges that might come up, whether that be, I don't have my card, I can't find my card, or I'd like to attend the event, but I'm not fully vaccinated. You'll want to handle those sort of away from the check-in desk, and you'll want to have a process for doing that. Next slide.
Okay. Communications for events. Hopefully this is pretty straightforward for you all, but just a nice reminder. that you should make sure that you're informing your guest before their arrival at the event to make sure that they come equipped with what they need for a great experience. Those things would include information about vaccine testing and symptom screener requirements and masking guidelines or requirements for the event. Please note a risk or no warranty statement, such as we don't guarantee that there's no COVID at this event. That's not required, nor is it recommended. Next slide.
Okay, and we have identified the required signage for events. There are two signs that you'll want to have at all on-campus events. One is a TSA-like sign that will list what the vaccination requirements are and the types of documents that the guest should have available to show at check-in. The second is a mask required sign or recommended, whichever sign matches the guidance for your event. And an optional sign is the COVID hygiene sign, the types of signs that you're seeing all over campus now. In fact, there may already be one near your event location. You can find information about these signage requirements on the campus events and activities portal on Blink. You'll also be able to find their information on how to borrow these signs. There are signs that already exist, and you may be able to borrow them either from your event venue or soon from campus curbside and from university centers or recreation if you're in one of their facilities. Or you can print your own signs. The signage assets will be available and you'll be able to print your own signs or order and purchase them from the campus sign shop. Next slide, please.
Okay, the events and activities intake form. This has been mentioned a few times already, and just a little bit more detail on what that is and what you should do with it. On-campus events, and this is if you're asking for an exception for an indoor event or it's an outdoor event that you feel that you're good to go on, both of those should be entered through the events and activities intake. Off-campus events are not required to complete a form at this time, but remember to follow those county and state guidelines. Things that you should be prepared to include when you make your submission is the host department head, chair, or dean, your host divisional vice chancellor, basic event details, date, time, location. Please note, if location's not available in the drop-down list, there's an opportunity for you to add it in. The list is not 100% comprehensive at this time, though we are working towards that. Be prepared to let us know your expected attendance, event details about the programming, entertainment, food and beverage, etc. And then, of course, last but not least, plans for COVID event-related precautions. Next slide, please. This is the current approval process grid. You'll note on the left-hand side is the host type and levels 0, 1, and 2 for approvals. So if someone other than the event planner themselves submits the information, the form will first route to the event planner. And then the level 1 will be what you see here. So the example of a UC San Diego department, it would be the host department head and then would route to the divisional vice chancellor area. You'll see college student orgs route to VC Satterlund, as does CSI, and then department student orgs and department graduate student orgs will both route to the EDC of Academic Affairs. Next slide.
Okay, so y'all have the big question of what happens with the event guidelines after October 31st. So right now, our suggestion to you is to plan for future events under the current guidance, knowing that adjustments will be made. And leadership is considering those adjustments and will announce those once they're defined. So make sure that you keep an eye on the Return to Learn website where any changes to guidelines will be noted. If you have an event and you're not sure if you should be planning it, we really encourage you to contact the EOC, have a discussion with them about ways to have a safer event, and have a conversation with your area leadership. They'll be able to guide you on whether or not you should be planning that event at this time. And they also have the opportunity to bring that to the COVID management team and to Return to Learn to sort of work through the process of whether or not it's an event that should be considered. So please be sure to consult with the EOC and your campus leadership if you're just not sure yet. As I mentioned, adjustments are being considered, and those will be announced once defined. Generally, the direction that we think we're headed is that vice chancellors will continue to approve events. Outdoor events will be allowed, masks will be encouraged, especially if a space doesn't permit distancing. Indoor events, once they're allowed, you can expect that masks will be required, and there will be other requirements that are still being determined. And food and beverage will be permitted at outdoor events. Self-serve buffets will still not be allowed, but served buffets, boxed snacks, and plated meals or individual beverages will be allowed. Next slide. And you can expect that the vaccination checks will continue forward with events in the future. So I just want to take a moment to say thank you for giving us this opportunity to share the information that we have. Earlier on the EEPM system that we're working on for campus, for the enterprise-wide system for campus, but also on these guidelines for your events now and hopefully for the future. Jill and I will both be here to answer questions in the question and answer with the other panelists. And thank you for your time.
Thank you again, Jill and Sharon, and thanks to all of our presenters today. Now it's time to move on to the question and answer segment, and I invite all of our panelists to turn on their videos at this time. So just to give a bit of information on how we'll use the remaining minutes together, during registration, attendees had an opportunity to submit questions for our panelists to answer. We have selected some of the most popular questions for the panel today. So if you have a question now, please also use the Q&A window to submit those questions during the session, and our panelists will do their best to provide our answers. And just as a reminder, due to our time limitation, we may not be able to get to all of your questions. However, we will post the answers in the FAQ at the Return to Learn site. Okay, so I am just looking for today's first question. All right, our first question is for Jill. Will we be allowed to host an overnight or multi-day conference this coming summer? Can we host high school students or community college students at our events?
Oh boy, don't we all wish we had the magic ball? Unfortunately, we don't. So I am going to go back to what Sharon just shared with us. If you want to have an event and you're not quite sure what the requirements are, as we aren't for next summer, go ahead and talk to leadership, and they'll have an opportunity to bring that to COVID management team and Return to Learn for vetting as we move forward in this process.
Thank you, Jill. I know all of our event managers have been doing incredible work adapting all year and a half, and we're very grateful for your patience. So thank you for all you do. Our next question is for Sharon. Can we book a facility reservation for winter 2022 and beyond?
Okay, I'll answer this question from two different perspectives. One is if you are the event planner, reach out to the venue and see if you're able to book that space. Just proceed with caution under the current guidelines and knowing that things may change. So, always good to have a backup plan. And then from the event venue side, if you are an event venue and you're wondering if you can start booking reservations for your spaces, we encourage you to talk with your area leadership, have that conversation to decide whether or not it's time for you to become operational with your venue.
Thank you, Sharon. I like the optimism behind that question. Dr. Sosha, this one's for you. How closely do we need to monitor density event capacity for an indoor and an in-person event? Or pardon me, excuse me, for an outdoor event and an in-person event?
I think the outdoor, it partly depends on the space you're doing. And to the extent you can spread people out, take advantage of the space. But we're not going with a strict rule. A seating event is a little different in that if you're going to have people shoulder to shoulder for a prolonged period of time, such as we had at Convocation, you may want to mask. So that's where providing those details on your event in the form becomes really important. We had our first women's volleyball event this weekend. And so we work with the athletics team to de-densify REMAC and bring the numbers down and come up with a strategy to minimize an indoor event. So we will need to look at each event and think about the nature of the event, where it is, the facility, the location on campus, and provide some guidance there. So it's not a simple one rule. I wish it were a little easier.
Okay, thank you so much, Angela. Back to Sharon for this next question. Can we use shuttles to transport people for events?
Okay, I recently consulted with the EOC on this very question and was directed to follow the San Diego guidance and the CDC guidance for public transportation. So the answer is you can if you follow that guidance. And of note, and I'm just going to consult my notes here a minute, that does mean that you'll have to require masks or face covering when riding the shuttle. And event attendees should be encouraged to open their windows or sit next to windows to increase the fresh air ventilation. And of course, you'll want to check for the vaccination status or symptom checker like you would for the rest of your event.
And I'm going to jump in with one more thing that you probably want to add. I'm going to steal Otis's thunder here, but we should probably check and make sure that you're going to be in compliance with 5402 if you're doing anything with transportation for your event.
Thank you, Jill. Excellent point. I see that you were listening closely to Otis. So, and this question happens to be for you, Otis. When will the restriction be lifted that UC San Diego Catering is the only catering provider for an event?
Well, unfortunately, as I said, this is a policy that was implemented as a compromise for negotiation. So I don't think that the policy is going away anytime soon. And that restriction is part of both the regional policy and ASME Article 5. However, if you may have options. If you don't need full service catering, where you have the caterer, they're bringing the food, they're serving the food, they're doing the cleanup. If you don't need that, you may have options to possibly go off site if you can do that, or if you're able to simply have an outside vendor drop off the food and you have it and you serve it yourself. Or you go and pick up some food and you serve it yourself, you may have options that way to give yourself some variety. But let me just say, the policy was designed and it's supposed to encourage UC departments to use UC employees when you're doing anything related to food service. So you may have those other options, but the policy does encourage you to reach out and use HDH if possible.
All right, Associate Chancellor Sterner, what would you like to offer?
I just want to say, I want to give a plug for UCSD Catering because we've been working with them over the course of pre-COVID, knowing that you saw the years that this has been discussed in this regental policy when it went into effect. We have worked with the housing and dining leadership team to staff up for the number of events that we knew that this was going to affect them with. I think they've done an outstanding job of building an executive chef leadership team and some really incredible culinary offerings. We've used them for a few high-end outdoor COVID compliant donor events. They've been outstanding. So I would say that maybe the campus catering that you might remember from years ago is a different campus catering than you will experience now. So I would just say that they've really prepared themselves for this to be competitive and to be a really high level special event resource.
Thank you so much, Associate Chancellor Sterner. And I'm afraid that is all the time we have for today. I want to thank all of you for your participation, your time, and your questions. And we'll be working to answer everyone's questions and updating our FAQ that's on our Return to Learn webpage. And of course, we'll be posting a recording of this town hall as well. And if you have time, we'd love to get your feedback, the post-event survey. And just as a quick reminder, the next staff town hall will be October 27th, and there'll be a faculty and research town hall on November 2nd. You can register by going to the town halls page on returntolearn.ucsd.edu. And I'd like to thank again our presenters and our guests for sharing their time and information. And I thank all of you, the talented and creative event staff and partners at UC San Diego, for attending today, for working together as a community, as VC Matthews mentioned when we came together, to bring us through these unprecedented times. This concludes the events town hall. Be well and take care. Bye-bye.